Today we're going to talk about exercise prescription. In sports medicine, we have a specialized method to prescribe a patient exercise. So we cannot simply prescribe a patient any sort of exercise without, regardless of what's the patient's background. We have to actually take into account their base of how they have been exercised. What we call it regular exerciser or non-regular exerciser. So there's a difference between people who has been exercising regularly and those people who has not been exercising regularly. So the first thing we should know the background of the patient is are they have been exercising regularly before this, and what kind of exercise do they enjoy doing it before we want to actually prescribe them any sort of exercise. Number two, we have to take into account their background in their job, how easy they can allocate their time to exercise. So after we take all that into account, so we can actually devise or plan a exercise for them to basically to meet their exercise requirement in a week. So according to WHO, we have to actually maintain exercise for about 150 minutes in a week, or 180 minutes in a week to have a maintenance, or 150 minutes to get a benefit for reduce weight in a sick patients. So the first thing we have to know is how what is a patient passion in exercise. So for example, we can prescribe them aerobic exercises for bicycles, jogging, hiking, but it is up to the patient what kind of exercise they actually they enjoy doing it. So there's no point we ask them to do jogging where patient is actually they enjoy doing more of bicycles, for example. So for aerobic exercises, we have this so-called FITTVP, right? FITTVP. So first one is frequency. How long or how much do we have to do the exercise in a week? So frequency, we can ask them to do about 30 minutes in accumulation to 150 or 180 minutes in a week. We can so usually, for example, for beginners, usually we can ask them to do a very small portion of minutes in a week for them to actually get used to it, right? And then the intensity is how vigorous the exercise is, for them to do the exercise. So, for example, intensity we can divide into mild, moderate, also vigorous intensity. So or high intensity. So how to measure intensity is by there's a lot of methods to measure the intensity. The easiest one, we can do a top test or a sync test, or someone who has a smartwatch with a heart rate monitoring, they can use that to calculate the intensity. But I want to just to show how easy it is to actually monitor the intensity of your exercise by this talk test. So the mild talk test, the mild intensity is whereby after a few minutes of jogging, for example, so at the end of it, if you were able to speak in one full sentence, that is actually a mild intensity. And if you were able to speak in sentences but a lot of breaks in between that is moderate intensity. But if you're not able to speak even one full word or only 2 words, that is high intensity exercise lah. Right? Okay, and then the time, FITT, time. Time is usually how many times would you advise the patient to participate in the exercise or to do those exercises lah. So usually for aerobic exercises, we would advise to do every other day or 3 times or 5 times in a week. That is also it has a lot to do with the frequency, so closely to do with frequency, because we want to we have to tell the patient how many times in a week, and in that time how many hours or how many minutes the patient has to do in that said week. Okay, and then type, like I said just now, there's a lot of types for aerobic exercises. It depends on what the patient enjoys. You have jogging, hiking, swimming. That is highly dependable on how the patient's enjoyment, and also you have to see whether is it available to the patient or not. Some people, they like to swim, but then the swimming pools are not luxury to them, right? And then volume. So the volume is whereby it's basically your exercise volume. So exercise volume is where you want to know whether is it enough for the patient for exercise or not. So for example, exercise volume, you have to do like frequency 3 times in a week. You tell them 3 times in a week, but in that every 3 times only 10 minutes. So 10 minutes in a week, 10 minutes in each session 3 times is not actually achieving that 150 and 80 minutes. But then you have to understand, so for some patients in the beginning, that is probably their best effort that they can do, then it's all right. But then if you were to maintain 150, 180 minutes in a week, then of course the volume of the exercise, you have to increase it accordingly, right? And then progression. So this is what really important, the progression. One of the principles of exercise to actually improve your health benefits. The volume is actually, the progression has to be increased each week per week. For example, let's say for beginners, you ask them to do 3 times in a week for 10 minutes. So maybe in a week later, in a week after that, you ask them to increase 4 times in 10 minutes or 3 times 20 minutes. So after a set period of time, hopefully they can able to get 150 or 180 minutes in a week lah. Right? So I think that's about the health exercise prescription. So basically, you have to tell them before exercise, before you want to prescribe any exercise for them, you have to see whether they are mentally prepared for it. There's a Prochaska change state of mind to know roughly how they are ready for the exercise. And also before that, you have to have a screening for every of the patients, whether they are actually able to be able to undergo this exercise or not. So if you think patient has cardiovascular risk, for example, you have to ask them to get some clearance from the any third party, the cardiologist or respiratory doctors. Also, any patients, you have to also tell them the most important thing, you cannot just jump into the exercise. You have to have stretching or warm up. We call it warm up and warming down. So usually it's 10 to 15 minutes dynamic warm ups, and then After the exercise, you have to do 10 to 15 minutes dynamic warming down as well. That is to get your heart rate to prepare for the conditioning exercise, which is the the hiking, bicycles, running, jumping, and so on. So after patient has been more conditioned to do those aerobic exercises, then for certain population of patients, you can also start incorporating anaerobic exercise or resistance strength training exercises. Those would be weight training and resistance or body training exercises. So that will be discussed in another session. Thank you very much.